socioeconomic deprivation was significantly associated with ischemic complications in giant cell arteritis, according to Dr. Sarah Louise Mackie. Neither hypertension nor atherosclerosis affected the impact of socioeconomic deprivation, and this novel finding deserves further study.
Why was it important to conduct this study?
Because ischemic complications are an important part of giant cell arteritis and are associated with a higher risk of permanent visual loss. So we wanted to know more about what predisposes to ischemic complications.
What were some of your key findings?
So the most important finding that we're reporting today is that people who live in more deprived areas were more at risk of getting ischemic features than people who lived in less deprived areas. This didn't seem to be just because of smoking or just because of atherosclerosis. So we think this is novel and interesting, and maybe is something that should be investigated further.
What are some of the clinical implications and next steps for research?
So this is very interesting, and the association with deprivation might be a clue to what causes giant cell arteritis or causes the ischemic complications in giant cell arteritis. So whether it's deprivation is acting as a better proxy for atherosclerosis than the medical history of atherosclerotic disease, which is what we measured in this study, whether it's other unmeasured associations of deprivation such as diet, sunlight exposure, infections, or whether it's perhaps due to people in more deprived areas not accessing medical help soon enough, so the delay to diagnosis of giant cell arteritis, and really sort of more research needs to be done into this. And also, when I was talking to patients for this study, most of the patients I saw hadn't heard of giant cell arteritis at all before their diagnosis. So I think an awareness raising campaign about giant cell arteritis is needed, and any campaign like that should aim to especially engage individuals living in more deprived areas.
For Global Medical News Network, I'm Heidi Spleet.